Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today African horse sickness disease will be explained, clarified in several series. African horse sickness has another synonyms such as Peridisceti, Pistis equorum, Lapisti equina, Pistis equina africana, and in Sudan its synonym is Abu el-Manazir. Diagnosis of African horse sickness. The major second part in diagnosis of African horse sickness is noticing of post-mortem lesions. Number 1. Lesions of pulmonary form. There are hydrothorax, severe pulmonary edema. Lesions of cardiac form. There are yellow gelatinous infiltration in the fascia of head, neck, shoulders, with hydropericardium and necrosis in the heart muscles. Lesions of mixed form. There are mixture of all the above findings of pulmonary and cardiac forms. Sudden deaths of infected horses at the beginning of epizootic of African horse sickness in the area with increasing in the body temperature that reaching to 41 centigrade. Frothy nasal discharge appear in this picture. A picture of frothy nasal discharge from dead horse diseased with African horse sickness. This picture cleared excessive fluid in the thorax cavity and pulmonary edema with distended intralobular septa. A picture of pulmonary edema in the lung of an affected horse. Pulmonary edema in a lung of a horse that infected with African horse sickness, and we see here clear intralobular septa due to the edema. Hydropericardium appearance in a horse dead from infection by African horse sickness. Hydropericardium appearance in a horse dead from infection by African horse sickness. Myocardial necrosis in a horse dead from infection by African horse sickness. One of the prominent post-mortem lesions in case of African horse sickness disease is the presence of edema and the gelatinous infiltration elsewhere in the body. Edema and the gelatinous infiltration in the muscles of the thorax. Edema and the gelatinous infiltration in the muscles of head and neck of an infected horse. Intestinal hemorrhages is one of the prominent post-mortem lesions in case of infection by African horse sickness. Intestinal hemorrhages is one of the prominent post-mortem lesions in case of infection by African horse sickness. Hemorrhages in the lung of an infected horse dead from African horse sickness infection. Frothy discharge in the trachea and gelatinous infiltration in the surrounding muscles of a dead horse from infection by African horse sickness. edema and gelatinous infiltration of the muscles of the thorax, excessive fluid in the thorax of the cavity reached to 10 liters of straw-colored yellow fluid. Differential diagnosis of African horse sickness. These 10 diseases have to be differentiated from infection with African horse sickness, anthrax, equine encephalosis, equine viral arthritis, equine infectious anemia, equine morbillivirus pneumonia, purpura hemorrhagica, equine pyroplasmosis, botulism, high doses of pyrrolizidine alkaloidosis, trypanosomiasis. African horse sickness series to be continued. Please subscribe the channel in order to be able to access the latest information and explanations.